All right, today we are talking about metabolic inflexibility and its relationship with TRT. All right, to understand what metabolic inflexibility is, you need to understand energy metabolism and how glucose and fats are utilized as fuel sources. Now, mind you, I'm going to translate this as simple as possible, okay? All right, so starting in practically every cell of your body, albeit minus red blood cells, there's these little things called mitochondria. Now, I refer to those things as little engines. And the reason why I do refer to them as little engines is because, well, just like combustible gas powered engines, they consume oxygen. Now, these little engines can use various things for fuel sources, namely fatty acids, amino acids, as well as carbohydrates. In otherwise healthy people, these little engines, these mitochondria, can switch between fuel sources based on energy demands, nutritional status, health status, yada, yada, yada. Some people refer to this as nutrient partitioning or fuel partitioning, whatever. So, for instance, there's also certain tissues that preferentially require certain energy sources versus others. For an example would be the central nervous system. It relies primarily on glucose as its primary fuel source. Long story short, in otherwise healthy people, the mitochondria have the ability to alternate between fuel sources based on energy demands. Pretty visual, folks. This gives you kind of an idea of metabolic flexibility and inflexibility. So, for instance, let's say you just ate. All right, we know that insulin is going to go up. This reflects a steady transition from the postprandial state to the post-absorptive state to the fasting state. When you're just sitting here at your desk at work for hours on end, or if you're sitting in your car on a long commute to work and you haven't eaten in a while, you're essentially right here primarily burning fats as fuel because you're essentially in a fasting state. Well, if you've just eaten, we know you'll be here until you reach that post-absorptive to fasting state again. Here's the problem. When you have metabolic inflexibility, when you're insulin resistant, fatty liver disease, metabolic syndrome, whatever falls within that umbrella, you have a mixed signal. In other words, your mitochondria don't know which one are they going to burn. Some refer to this as mitochondrial congestion. I've heard also mitochondrial hazard, as well as metabolic inflexibility, which is what we're discussing right now. In other words, your mitochondria can't utilize the proper fuel source in the appropriate situation. So what does TRT have to do with this, and what are some things we can do about it? Well, we know that testosterone in itself is one of the most powerful drugs you can implement when treating people with metabolic disorders. We know that it increases insulin sensitivity, it increases glucose disposal, it increases bone mineral density. Heck, even from the estradiol itself, that portion alone has been known to reduce visceral fat, which is one of the principal things that we find in people who have these metabolic disorders. Heck, the improvement in body composition alone is great, even if that was the only thing you got from it. But you also get improvements in cardiovascular performance, cardiovascular capacity, as well as improvement in your lipids. All those amalgamation of improvements and characteristics that you can get from TRT, all those can improve metabolic inflexibility. But the literature appears to show that one of the best things that can help improvement that you would get from TRT would be the improvements in lean body mass, in body composition. Besides TRT, another thing people should employ, and this one's free, is exercise. What we do know is that physical activity and increasing or improving your body composition alone, especially through exercise alone, can increase your mitochondrial density and mitochondrial sensitivity to the different nutrient sources that it's getting. So they will signal better in response to carbs, and they'll signal better in response to fats, and they'll signal appropriately to that demand stimulus. So L-carnitine is another thing, another substance that can possibly help improve mitochondrial congestion or metabolic inflexibility. And it does so through a few speculated mechanisms of action. Okay, so for one, L-carnitine can transport fatty acids across the mitochondrial membrane. Now, the mitochondrial membrane is actually impermeable to fatty acids with long carbon groups or long carbon chains. In this case, 12 or more makes it impermeable to the mitochondrial membrane. However, L-carnitine can penetrate that membrane and it can shuttle fatty acids into the mitochondrial for beta oxidation. And lastly, other things that may possibly help improve metabolic inflexibility include photomodulation as well as methylene blue. And if you want to know more about methylene blue, check out a previous video that we've done on it. All right, This concludes our series. Thanks for watching.